So, if you have advanced gastrointestinal stromal tumors and have had ostomy surgery, that means your body now has a new way to remove waste. Instead of going to the bathroom like usual, your waste will now go into a bag attached to your belly. This might be temporary or permanent. After the surgery, you'll have a new opening in your body called a stoma. Your waste will pass through this opening into a small bag, also called a pouch, that's attached to the outside of your body. You'll need to empty the bag into the toilet a few times each day. It might feel strange and overwhelming to have to do this, but you're not alone. Many people have ostomy surgery, not just because of GIST, but for other reasons too. It's important to learn how to care for your body properly to avoid skin irritation, infections, and leaks. When it comes to caring for your stoma pouch system, there are a few things to keep in mind. First, your healthcare team will help you choose the best system for your body and its needs. There are two main types, one-part and two-part systems. With a two-part system, you'll have a pouch and a skin barrier that attaches and detaches from the pouch. This allows for easier changes. With a one-part system, the pouch and barrier stay connected. To care for your system, it's important to empty your pouch before it gets too full, usually when it's about a third or half filled. It's also important to change your pouch system, including the skin barrier, every 3 to 5 days. If it leaks, be sure to change it right away to avoid skin irritation. Consider emptying your pouch before bedtime to prevent it from filling with gas overnight. Today's stoma pouches are designed to be odor-free, but if you notice any odors, there are products you can use to help. Some pouches have carbon filters to prevent smells, and you can also use deodorizing drops or charcoal tablets. Just be sure to check with your doctor before trying any new remedies. When you empty your pouch, it's important to check your skin around the stoma for any signs of redness, irritation, or moisture. Catching any potential infection early is crucial, so be sure to reach out to your healthcare team as soon as you notice any issues. Sometimes, the products used in your pouch system, such as adhesives, the skin barrier, or the pouch itself, can cause irritation to your skin. Even if you've used them successfully for a long time, it's possible for them to start bothering your skin. In this case, your doctor can prescribe medication to help. Keeping the skin around your stoma clean is important. Use water and mild soap to wash the area, and avoid using alcohol, oils, or fragrances. Alcohol can dry out the skin, perfumes can trigger allergies, and oil-based soap can make the skin slippery, which can make it difficult for your pouch to attach properly. If you have hair around your stoma, consider carefully shaving or using other hair removal methods to ensure that the hair doesn't interfere with the attachment of your ostomy system. However, always check with your ostomy nurse for specific instructions. You can shower with your stoma pouch on or off, but if you have an ileostomy, you may need to keep your pouch on. Your doctor can provide guidance on this. If you take a bath, it's recommended to keep your pouch on. Having an ostomy doesn't mean you have to completely change your diet. In fact, most people can return to their normal diet after recovering from surgery. However, you may need to be mindful of certain foods and beverages, especially during the first 6 months after the surgery. It's important to pay attention to how your body responds to the foods you eat. Some foods may cause gas, which can inflate your pouch. If this is an issue, try avoiding gassy foods like cruciferous vegetables, beans, onions, spicy foods, and chewing gum. Certain foods may also be harder to digest and could potentially block the opening to your stoma. It's important to be cautious and possibly limit your intake of foods like popcorn, corn, nuts, seeds, dried fruit, and mushrooms. Staying hydrated is crucial for your health. Drink plenty of fluids and avoid or limit dehydrating substances such as caffeine, alcohol, and foods high in simple sugars. For personalized advice on your diet and hydration, consult with your healthcare provider. You might be worried that wearing tight clothes will make your pouch visible to others. However, there are ways to hide your pouch if needed. You can use special wraps and underwear to keep it out of sight. Some people also find that using colors and patterns can help disguise their stoma. For example, if your stoma is above your belt line, wearing a patterned shirt can help, and if it's below, wearing patterned or dark pants can do the trick. Men can also switch from tight belts to suspenders, which can help hide their pouches. So, let's talk about some common concerns and fears that people have when it comes to having an ostomy. First, let's talk about exercise and sports activities. Many people worry that having an ostomy will limit their ability to be physically active. However, you should be able to take part in most sports and exercises. Your doctor may advise you to be careful with contact sports or doing activities that involve heavy lifting. Also, sweating could affect how your pouch sticks to your skin, so if you're working out, consider buying a special workout pouch. Next, let's address the myth about travel. It's not true that if you have a stoma, you can't fly. You can travel in planes, trains, automobiles, or any other way. Just be sure to pack plenty of stoma supplies in case of any delays, lost luggage, or other problems. And finally, let's talk about sex. Your sex life isn't over because of your ostomy. Experts say sex with a stoma is safe once your surgical cut has healed. You may want to use wraps to hide and protect your stoma, and it's helpful to communicate honestly with your partner about your feelings and concerns. If intimacy remains difficult, you may want to seek counseling. It's important to remember that having an ostomy doesn't have to limit your life in any way. With the right care and support, you can continue to live a full and active life. Living with an ostomy can be a big adjustment, and it's natural to feel worried about the changes it brings. Many people also experience feelings of depression, especially if their ostomy is permanent. Here are some steps you can take to help you feel better about your ostomy. Instead of avoiding your stoma, take the time to look at it. This can help you accept and feel more comfortable with this new part of your body. Remember the reason you had your surgery, to treat your gist and potentially extend or save your life. Connect with others who also have ostomies. Support groups, both online and in person, can provide you with the opportunity to learn from others who have been in your shoes. Many people living with ostomies lead active, happy, and fulfilling lives, and hearing their stories may help you find a positive way forward.